So this is the part of fundamental of nursing care. And today's we are going overview a therapeutic communication in nursing sciences. Some books said this is therapeutic relationship. So therapeutic communication. Before to go therapeutic communication, here are some terminology related to communication and relationship. So if you really want to understand this PowerPoint, if you really want to know what are the effective way of communication, you need to know some terminology. What is related to effective communication? First one, communication process, then therapeutic communication, active listening, and feedback. So the first one, communication process, what it is. So communication process means the exchange of information, feelings, needs, and preference between the two peoples. So communication process means, let me recap it. This is the exchange of information, feelings, needs, and preference between two peoples. And therapeutic communication definition here. Patient-centered communication used to promote a greater understanding of a patient need, concern, and feelings. So therapeutic communication basically a complex process. Why it is complex? Because by this process, you sending information, someone receiving information, and also a comprehending message exchanging between two or more people. Therapeutic communication is a dynamic and ongoing process, and that create a unique experience for the participant. So what I told you, as per I told, that therapeutic communication is a dynamic and ongoing process. So when you welcome a patient in the hospital, you introduce yourself. You will try to make a good friendship with them, trustable relationship. Then you ask some leading question, and then if patient trust you, rely on you, they can share their story. And then you can make a diagnosis. So I said, therapeutic communication is a dynamic and ongoing process, right? So when as a doctor or as a RN, when we communicate with the patient, communicating always will be effective. And effectively is a very skill that nurses must develop. So a RN or LPN or nurses use the communication when providing the care to demonstrate the caring or establish the therapeutic relationship or obtain and deliver the information. And also assess to the make the patient life easy or make the comfortable to the patient for the patient, or we can say assist with changing the behavior. So first of all, I'm saying whatever we do in the hospital, everything should be patient centered or patient focus. So they are the main focus, right? It is the part of the therapeutic communication. So now go here, active listening. So like you ask a question to the patient, then be a silent. Silent means you are interested to listen, and also patient will be organized their thinking, and also patient will be verbalized their feelings with you. So here said active listening. So as a good RN or good LPN, always we will be an active listener. So they said the techniques that use all sense to interpret the verbal and non-verbal messages. So when you're dealing with the patient, we called it as interpersonal communication. Interpersonal means you and your patient. Like you are talking with yourself. This is called intrapersonal communication. But when you talk to any other person, we call it interpersonal communication. And now go for the feedback. So what is feedback? Like you are teaching to a group. After teaching, you tell them, can you recap? Or you teach a patient how to use the subcutaneous insulin. After finish, you tell your patient, can you show me how you can give the subcutaneous insulin by yourself? Right? This is demonstration. This is feedback. This is remodeling. So a returned message or sent by the receiver to information, and that complete the communication process. So basically, when we send the information to the patient, like you are RN, you are teaching your patient, so you are the sender. Who received the information? They are receiver. And what you want to print to their mind, this is the information, or I said message. So now go here, body language, non-verbal communication, and verbal communication. So before to go body language, non-verbal communication, or verbal communication, I could review something. I said feedback, right? So this feedback can be verbal. This feedback can be non-verbal or positive or negative. So the message that receiver return to the sender that indicate the receipt of the message. So an essential component of ongoing communication is a feedback. So now I said what are the method of communication? So method of communication sometime vocal or vocabulary, or sometime non-verbal, right? So before to go the verbal or non-verbal communication, let me go some word here. So body language, basically a non-verbal communication, right? Non-verbal. So like I said, when a nurse interact with any patient, the nurses should be aware of how they communicate non-verbally and should determine the meaning of the clients. And non-verbal communication also the important factor to communicate the patient. So non-verbal communication, the component are facial expression, posture, body position, behavior, gesture, touch, and general appearance. So like our appearance, or I said my posture or my gait, the way of walking, even it is the part of body language or non-verbal communication. Let me recap it. So basically here I said the physical character even can convey the professionalism. I said physical characteristics also the professional one of the way of express the professionalism. Body language or posture can demonstrate the comfort, and also it is the situation. The first impression is very important to the patient, right? So when a patient got hospitalized, they are helpless because they do not know what is going on inside their body. A patient is heart failure. They do not know they're going to die or they will be okay. So they depends on you. When they come in hospital, if they see you looking is not professional, and they will not get trust on you. When they say I am in hospital, I am with the right person hand, psychologically they will be cured. It is healing process. As I told you, appearance is or body language is way of non-verbal communication. Even facial expression, eye to eye contact, and gesture also non-verbal communication. Sometimes NCLEX board give which one is a example of non-verbal communication. Which one is a way of verbal communication? Like I'm talking to the patient, everybody say it is verbal communication, but I'm writing to something. It is also verbal communication, writing. Let me recap it first. This one, the facial expression. So facial expression can reveal the feelings that client can easily misinterpret it. So if you are sad, your expression, if you are angry, your expression will be different. If you love someone, your expression will be different than if you hate someone, right? So also the eye-to-eye contact. So eye contact typically convey the interest and respect as well. Hmm? But also you should keep in mind some culture do not allow eye-to-eye contact. They think it is sign of rudeness. So we should be aware about the cultural awareness and situation. And here say gesture. So gesture can also enhance the verbal communication or create their own message. Hmm? So non-verbal, what are the other difference? So this is communication conveyed by body language or less conscious and more indirect than the verbal. The verbal communication here. What are the example of verbal communication? Hmm? So they said a conscious use of the word, either spoken or written, to communicate or more direct than non-verbal communication. So I said in NCLEX board, NCLEX PN board, if they wrote which one is a verbal and like written, so don't get confused. You can write something you do not speak, so it doesn't mean that written is a non-verbal. Written is an example of verbal communication. So if you use any vocabulary, this is verbal communication, right? Like vocabulary means these are the words that communicate a message the sender either writers or speaks. So now here showing like I said in the next PowerPoint or in the PowerPoint, we are also going to talk some particular terminology also related to the verbal communication. What next? So what are the benefit of effective communication? Hmm? You see the terminology used here, benefit of effective communication. If I write benefit of communication, if I do not use effective, it does not mean any sense. It does not make any sense. So when you deal with the patient, like you are teaching your patient how to use the heparin, what are the signs and symptoms of hypoglycemia, what are the signs of bleeding disorder, like you are talking 20 minutes, try to convey something information to the patient, you want to bring something to patient mind, but after end of the communication you see your patient does not understand what are the language you are talking, right? So before to talk, before to educate, before to reinforcement, we have to make sure my patient can understand my language, my patient can understand the way of I'm talking, is it productive? So if communication always be effective, otherwise it does not make any sense, right? So effective communication is very important, and sometimes we called it is the therapeutic communication. Okay, so now go here. It helps establish the proper transfer of health care information. It is essential to proper documentation. So after finish the communication with my patient, after all of intervention, finally I keep the documentation. It is a key element when reporting the information to other members of the healthcare team. It helps the nurses build a relationship and carry out the professional responsibilities. What next? The communication process. Communication process, right? An exchange of information, feelings, needs, and also uh, preference between the two peoples or in a group of peoples. An active process that involves informing or sending or receiving the information or message. So communication process include listening, right? And then observing, processing, and also comprehending in a reciprocal fashion. So, my friend, try to understand me. When I talk to the patient, I could ask a question what is relevant to the patient health. I can't ask them any irrelevant question what is not related to the patient interest or any personal question. I will not ask, right? So after ask a question, I will be silent. So be silent is the part of the communication. So when you be silent, this allow the time for meaningful reflection. So this time patient can organize their thinking. It means you are willing to listen them. Then listening, it is called active listening. So active listening, this helps the nurse to hear or observe or understanding what the client communicate and provide the feedback. So when you give them time to verbalize their feelings, they can feel good, right? They can express their all feelings. And when you ask the question, it would be open-ended question. Also, you can clearly ask a question, short direction. So what next? They said the goal of communication established a mutual understanding of the meaning of message, also known as shared the meanings that indicate the message was communicated as intended here. So it would be very meaningful, right? So as I told you, always clarifying the techniques for a effective communication, because when you clarifying the techniques, this help the nurse determine whether the message the client received was accurate or not. So when we deal with the patient, we make a focusing or goal of communication. Because our target to giving the information or make a summary what they understand or not. Here's something more about the verbal, non-verbal communication. Verbal communication, they said, always conscious use the words either spoken or written. Non-verbal, maybe body language, facial expression, posture, body position, behave, gesture, touch, or general appearance. Factor affecting the communication. So first of all, what are the factors act as a barrier of communication, or what are the factors affecting the communication? Here say personal space, body position, language, culture, attitude, and also emotion. So personal space, because sometimes some culture do not allowing too much close. They prefer make a distance, good distance. And even if you do not know your patient well, if you talk too close, they will not feel comfortable, right? Even the body position, the way of walking, your hands, everything is a reflects the communication. So when you asking the question, it is also important. It is also the affecting the communication. So always you asking relevant question or asking irrelevant personal question is not a good way of communication. It affecting the communication. So language is another factor of affecting the communication. So if the patient do not understand my language, always we will take the licensed medical interpreter. Culture, so if I do not know my patient culture, how I will talk to them? I will respect the other culture, and if I know the other patient culture, it would be easy for me to convey the information. Attitude, so always be helping attitude to the others, be kind to your patient. Also emotion, if you too much emotional, not a professionalism, it is not good for the patient. So you always be professional. Now here showing the 4 personal space distance zone, like intimate or casual personal, social consultatives, and publics. So here publics at least 12 feet if possible, social 4 to 12 feet, And also casual person means at least 18 inches or to 4 feet. And intimate means it is closer, something whispering to the ear, ringing from physical contact to 18 inches. So body position that promote the effective communication. So communication at eye level with other person. So it is means the both participant are interested. Lean slightly forward. It means you are interested to hear. You are bending little bit. Maintaining an open body posture, also a sign of good communication. Effect of culture on communication process. So how culture reflect the communication, right? So here we go, how to the culture reflect it. So they say the share the values, belief practiced by the majority within a group of peoples include accepted attitude, roles, behaviors, and religious or spiritual practice. All is the important component of effective effect of culture on communication process. Cultural sensitivities means respect for accepted pattern of communication in a culture. So if my patient get a mental peace by follow their trust, so spirituality can help to healing. So it is not my problem. Let them do this, whatever my belief. So the two meaning of the word in this profession. Okay, so what are these two words? One is called denotative. You see the denotative and connotative. So denotative means when the communication or participant must share the meanings. So reflect to the here literal meanings or absence any interpretation. So as I told you, denotatives, it does means when the communicating or participant must share their feelings, okay, or absence any kind of interpretation. And connotatives means usually the words we use that have multiple meanings can cause the miscommunication if the people is interpret them differently. So here talking the connotative means refer to the emotional association that can be attached to the word. So means the word that have a multiple meanings and can cause the miscommunication if people interpret them differently. There's so many words like this, different meanings. Also, the word, if you expression, also important, right? What next? Therapeutic communication here. The therapeutic communication, the nature of this communication here first, let me show you and what the NCLEX board asks. about the therapeutic communication here. So therapeutic communication always patient-centered communication, or always would be patient-centered communication. Goal is to promote a greater understanding of a patient's needs, concern, and feelings. The nurse helps the patient explore their own thoughts and feelings, also encourage the expression of them, and avoid the barrier to communicate. So let me tell you something more for NCLEX board exam. So therapeutic communication always will be purposeful. And always I said therapeutic communication is the purposeful use of communication to build and maintain the helping relationship. Helping relationship with whom? With clients, families, and significant others. So we are RN or LPN. So NUS use the interactive purposeful communication. So in this therapeutic communication, elicit and attend to the client's thoughts, feelings, concern, and needs. Always express empathy and genuine concern for clients and families issue. Also obtain the information and give the feedback about the client's status. And therapeutic communication is something more we could know. So I said that when we interact with the patient or intervene to promote the functional behavior and effective interpersonal relationship. Also, evaluate the client progress towards desired goal and outcomes. It is very important let you know, and also in this PowerPoint it is, I'm coming to explain, but I like to share here something. So when you deal with the children and old client, it would be a little bit different. So the client, children and old client often require specific or age appropriate technique to improve the communication. So always use of the nursing process depends on therapeutic communication among the nurses or clients, families, or significant others. But what is most important, every student have to remember or keep in mind, communication always be client-centered or patient-centered, because patient is your main focus. What next? So now therapeutic communication technique. So first of all, when you communicate with the patient, we ask them some question. It is called providing the general leads. Like my patient has a fever, the next question will be the timing of fever. Is it continuous or is it intermittent? If my patient complain about the pain, the leading question will be, What are the migration of the pain, the nature of the pain, right? So we providing the leading question, we providing the general question, what is relevant to the patient. After that, we will be silent. So this general lead question using silent, this is an effective skill and techniques. So silent, this allowing the time for meaningful reflection. They prepare to answer you. And also offering the self, active listening. So active listening or offering self, this help the nurse to hear, observe, or understand what the client communicate and provide the feedback. Using open-ended question and statement. So asking question is very important. So asking question, this is a way to look for additional information. They said using open-ended question. So this open-ended question means this facilitate the spontaneous response and interactive discussion. It encourages the client to explore the feelings and thoughts and also avoid yes or no answer. So you will not ask a question that they can answer by yes or no. It is better to avoid and always encouraging, ask them open-ended question. Then restarting the communication. What does it mean, the restarting the communication? So let me tell you something more. So therapeutic communication, we use the clarifying the techniques. Clarifying techniques helps the nurse to determine whether the message the client received was accurate or not. So restarting communication means use the client accurate word, restarting. So what they said, you can rephrase it. You can restart the client statement or it's called the paraphrasing, means restart the client feelings and thoughts for him to confirm what he was communicate or exploring. Exploring means allow the nurse to gather more information about important topic the client mentioned. So I said provide general leads, very important. Means we offering the general leads or broad open statement. So this encourages the client to start and continue talk. So they verbalize their feelings, general leads. All when you listen, you always showing acceptance and recognition. So this acknowledges the nurse interest and non-judgmental attitude as well. What next? Therapeutic communication next is called looking for clarification, giving the information, reflecting the communication, and looking at alternative and summarizing. right? So before to go here, something go back again. You see, offering self, offering self. This demonstrate a willingness to spend the time with the client, and this the nurse may share the limited personal information, but the focus should return to the client as soon as possible, or relevant self-disclosure by the nurse help the client to see what others share his experience and understand. So it is called offering the self. And whatever or when we um, take the history or interact or communicate with the patient, we have always a target for focusing, and that as per I told you, patient centered. So focusing this help the client to concern on what is important basically. So next here, they said here, giving information. Giving information means this provide the factual details that the client might need for decision making. Like a patient need to surgical operation for a tumor, you can tell what are the different options of the treatment for the tumor, like chemotherapy, radiotherapy, surgical removal, or what are the future if they does not take the treatment. So when you provide the information, this providing information details the client might need for it for making a decision. So always when you tell something treatment option, you can also explain what are the alternatives for the patient. Choice is theirs. If they like, they can take the treatment. If they do not like, they can deny. It is their rights. Also, summarizing. What does it mean, summarizing? Summarizing means this emphasize the importance point and review what the nurse and what the client have discussion. So make a summary on you and your client discussion. What next? Next here, during the communication, what are the barrier to communication? Asking question with yes or no response, yes or no response. So you ask a question and answer is yes or no. It is the barrier. It is not a good question. We said encouraging the patient to verbalize their feelings. So open-ended question is better than ask anything with yes, no response. Giving false reassurance. Like a patient is diagnosed by a terminal illness, means they going to die. But you tell them, no, no, all is fine, all would be fine, or everything has a treatment. So don't give false reassurance. Asking too many personal questions is not a good way. Giving advice, right? Or also battling the patient feelings or expressing disapproval. So I said this is the barrier of effective communication. So when you deal with the patient, asking irrelevant personal question, this is the barrier. Offering personal opinion, it is the barrier. Stereotyping is a barrier. Giving advice, it is the barrier. Giving false reassurance, barrier. Or minimizing the feelings or changing the topic. Your patient talking something relevant to their health, but you change the subject. It is the barrier. When you deal with the patient, asking any question by why or why question or asking for explanation, this is the barrier. Anything challenging like a data given by the patient and you feel it is not the correct, maybe or may not, need to um, clarification, but we can't make a challenge to the patient. So challenging is a barrier, or offering value judgment is a barrier. So don't go for judgment, or asking the question excessively, or any kind of responding disapproval, the refusing, it means refusing, or any defensive behavior, also barrier. Testing, judging, offering sympathy, or even arguing, everything is a barrier. So now here, what is the style of communication? So if you read the different book, you can get the communication among the health profession. We see it the style of communication. So when you are a nurse, when you communicate with your client, the nurse must communicate very clearly, respectfully, and professionally with all staff member and with all client. So say passive or avoidance, avoid confirmation or unable to share the feelings and need with others, or any aggressive, put one's own needs, rights, and feelings before those others, or assertive means stand up for oneself without violating the basic right of others. Assertive. So, like you are working in a department, so the faculty communication among the member of the healthcare team can have a negative effect on the work environment and also the client output. So when you work in a hospital or any facilities, you sometimes face with some difficulties like uh, violence or bullying. So bullying means repeated words or act of intimidation, or violence means abuse words or action of peers. Is a violence. It is very common during the working. Now here the method of communication. They said DESC. D stand for describe the behavior, E stand for explain the impact of behavior. S stand for state the desired outcome. And C stand for consequence should grab the personal attention. So method of communication means always we have a focus to desired outcome. We have to explain the impact of behavior and also describe the behavior and consequence. The two sides of anger here during the communication, what it is. One is called guilt and another is called the resentment. So guilt means direct inward at something we did or we did not do. And restatement means direct outward at others for what they did or what they did not do. So here some tips how to talking with the supervisor. So before to go to discuss how to talk with supervisor or nursing leader or manager, it is important, let me share with you, when we deal with the children patient or elderly patient, it is very important when you deal with the children or any mental health problem patient, always we could use the simple, straightforwarding language and be aware of non-verbal messages because the children are especially very sensitive to non-verbal communication. And it is also important improving communication by using at the children's eye level or incorporate play in interaction. So now, before to go supervisor, let me recap one more point. When you deal with the older client, we always recognize that many older adults require amplification of the sound and make sure assistive device such as glasses or hearing aid are available for the client who need them. And when we deal with the elderly patient, so always we speak in a short and simple sentence and allow the plenty of time for the client to respond. Now let me go and talk how to deal with supervisor. So keep your supervisor informed. So what happened in the floor, we could inform supervisor. If a problem develop, make an appointment to talk it over and show that you have important information to share and hold a sense of responsibilities. And be careful which word you choose when you deal with the supervisor. And do not talk to your supervisor when you are angry. Do not respond with anger. So we have to control our tongue. So to present a new idea, give your supervisor a written proposal and then meet to discuss it. Accept the feedback and learn from it and never go above or beyond your supervisor. SBAR guide of communication. S stands for situation, B stand for background, A stand for assessment, and R stand for recommendation. So SBAR, situation, background, assessment, and recommendation. So this is the technique to provide a framework for communication between the members of the healthcare team about the patient condition. So I said yes for situation. So we have to keep all patient record like patient code or problem we calling about, everything we have to keep about the patient information. Background means, I said the background means the patient mental status or the patient condition like the skin or any kind of patient need. A means assessment. A means assessment means, so assessment means this is what patient, when I deal with the patient, we take the history and we make a summary. What patient need? What are the patient problem? The problem seems to be cardiac, infection, neurological. We have to find it out after the assessment. And R for recommendation. After assessment, you decide what kind of problem patient is, respiratory, cardiac. Then we could recommend them to the department. Like what physician need, or we can transfer the patient to critical care, or the patient physician will come to see the patient. It depends upon patient condition, but who assessment? You, right? Also, if patient bad situation is really bad, you talk to the patient family about the status of the patient. Even ask for consultant to see the patient if need. Even if patient need any kind of change the treatment plan, you can talk to the doctor as well. So SBAR, shortly called SBAR, it is very important for board exam. So information given when the contacting a physician. Like you are going to talk with a physician about your patient. What are the information you have to gather before talk to the healthcare provider? Like before talk to the physician, go and do a quick assessment of the patient, like vital sign. Is it fluctuating? Temperature is okay? Or compare and contrast the assessment right now and what you do 1 or 2 hours before, any fluctuation or not. Or statement of problem, why you are calling. So you are going to call, but you have to know why you are going to call. What are the patient complaint? Patient condition is going to worse or going to become better? Need to change the treatment? What are the problem of the patient? You have to figure it out. Keep it note, then make a phone call. Also gathering the current data. So when patient got hospitalized, the data And when you're going to call second phone, third phone, and this data, compare, contrast, gather any new complaint or not, such as vital sign, if laboratory report any abnormalities, you have to interpret the laboratory data. What is normal, what is not normal. Also, diagnostic test. You have to prepare any positive sign to convey the physician. What information the physician may need to make a sound decision. So on based of your information, your data, physician make a plan. He will come now or later and what we'll do next. So here the type of downward communication including job instruction, job rationale, practice and procedure, feedback and role modeling. So downward communication, it is the flow of information and the message from a higher level include inside an organization to a lower one. Effective downward communication is very crucial or vital to an organization's success. So I said, like you are LPN, you inform the RN, or RN talk to the nurse leader, or nurse leader talk to the physician regarding a patient condition. Then physician convey the information, then it is come to the root level, downwards direction, right? So I said the effective downward communication is very vital to an successful organization, right? Because it is not possible the leader should be the workplace all the times. Here showing the items to include in a shift report. So what are the tools we have to include it in a shift report? Like basic patient data, sign and symptom. If patient need any schedule for procedure, we have to mention. Also diagnostic result, if any abnormal assessment findings, like I'm going to leave my shift, the new RN is joining there, suddenly patient blood pressure is going up or temperature is fluctuating, I have to keep a note, keep a documentation so the new RN easily catch up. Or interdisciplinary therapies ordered, or various ordered treatment. So if any, we have to mention in the note. Patient with special communication needs. So people who are deaf or hearing, hard to hearing. So when we deal with them, it is very important to provide the device first, hearing aid, visual, eyeglasses, we have to provide it first, I said. Or people who have a speech or language impairment, or patient on mechanical ventilation, or patient who are unresponsive, means unconscious or under coma, or children, even old person. So now here, three major state of intervention: opening, body, and closing. Three major stages of interview. One is opening. What does it mean? Introduction explain of the purpose, and established a report. So like I am working in the emergency department, suddenly a patient came with chest pain. Before I touch the patient, I have to introduce who I am. Like I said, I am RN for today, or I am the RN Tom to give a treatment or take a history from you. Give the permission, explain what you are going on, what you are going to do, purpose, and always establish a trustable relationship first, right? And body, main part during which the questioner asks and answer. I said leading question we have to ask, open-ended question. Tell, be silent, give them time, organized, verbalize their feelings, keep record, note for a summary, closing, completion of all questionnaire, patient questions, and thanks for the ending for participation. So when to use open-end and close-end question. I already explained what is open-ended question, what is close-end question. So open-end question, always we ask the beginning of interview, changing the topic or drawing out the attitude. So changing, so we do not change the topic suddenly. When you ask the closed-ended, obtaining specific data, like patient say, I have a pain in my chest, but you want to know where accurately the pain. You tell your patient, can you show by one finger what are the location of pain? So this specific close-ended question to specify the data. Is it mid of the chest? It is left side, right side? Because when they show you are the person who have enough anatomical knowledge, pathological knowledge, you see what are the structure under it, maybe problem arise from that organ, right? Information connection feature. So as a good RN or LPN, you have a clinical connection. So I said, you came to the school, you gather some anatomical knowledge, physiological knowledge, disease process or pathological knowledge. Then you get your license, you start work in hospital, you gather skill. So when patient come, you take the history, you connecting each data together, you connecting your anatomical knowledge, your physiological function, and pathology, how to disease occur. So it's called clinical connection, what you gather from book, from your skill. And whatever it is, always it should be real world. So it is related to the patient or with reality. And all of the connection or information you gather because you from your knowledge, you have the knowledge, you learn from the school, you learn from anatomy about the human structure, you learn how human cell work, how what is metabolism, how ATP production, why you are talking, we are driving car, we are participating in school, because of the cellular function, and this is the physiology, right? And also play peoples and place and post conference. Patient come to you, you go for the assessment, then you go for diagnosis, you talk to the healthcare provider, and they diagnosis also. Then you make a plan. It's called intervention planning. Why you are doing everything for outcome? How you get the out? What is the outcome? Patient become healthy, or patient will be good from sickness. This is the outcome. But this outcome, who can exclude? By we can exclude by evaluating, and this is called post conference. So after the treatment, after the intervention, we can make a summary or summarization by a conference. So everything is a patient centered, patient oriented, patient focused, is called patient centered care. So this is the PowerPoint up to now about the therapeutic communication.